Good afternoon, everyone. I want to thank you for investing your time with us today. This is Catalina Agregia. I'm a functional medicine practitioner and board certified in internal medicine. And I am passionate about functional medicine. And I want to share other doctors' stories, doctors that started practicing functional medicine because of something, because something happened in their lives, or they saw functional medicine as their passion, as their best way to help and people and impact lives. So today we have a very special guest all the way from UK, Dr. Grace Hula, who is a general practitioner who's an expert in functional medicine, PhD in neuroscience, and member of the Royal College of General Practitioners in UK. So it's my pleasure to introduce to you Dr. Hula. Grace, welcome here. How are you today?
Thank you. I'm fine. Thank you. Thank you for inviting me. I'm also very passionate about functional medicine. So thank you so much for giving me the opportunity to share my thoughts.
Absolutely, my pleasure, always. So, first of all, tell us a little bit what made you look at functional medicine? What is your story?
My story is actually quite interesting. I was working as a senior house officer in a medical ward, actually on a diabetic ward, when I discovered that I had type 2 diabetes. I did a urine test. I was, of course, getting the symptoms, feeling very thirsty, running to the toilet all the time. I put on weight. So when I checked my blood sugar levels in the urine, they were really high. So I checked myself to my family physician, who did a blood test, and the results came back and showed that I had type 2 diabetes. I was called in. The levels were so high, they decided to admit me on the same ward that I was working in. It was so embarrassing. But after a year of taking metformin, which is a diabetic medication, a common one, I started doing my research and I realized that I could actually turn things around. And so I changed my lifestyle. I lost a lot of weight, like 3 stones, which is about 20 kilograms in pounds. I don't know how many pounds that is in pounds, but with that, I'm actually stopped taking the metformin and I reversed my type 2 diabetes into remission. This was in 2007. And yeah, since then, I have actually every year when I check, I'm more or less normal pre-diabetic blood sugar levels. So this spurred me on to think chronic diseases can be reversed. And why are we not looking for the root causes of diseases? And that's how my passion and my functional medicine journey started. I started helping other people. One thing led to another. And then I did training in functional medicine. And I realized this whole lot of diseases can be reversed.
Absolutely. And how is functional medicine viewed in UK?
It's not big, it's growing. But at the moment, if you say functional medicine, everyone's like, what's that? What's functional medicine? So we need to do a lot of education, a lot of webinars, a lot of seminars, form communities, educate people, because at the moment, functional medicine is not well known at all, which is so sad.
Yes, absolutely. Yeah, and it's so interesting that most people that decide to start practicing functional medicine do it after their own, let's say, negative event in their
Yeah,
lives.
yeah,
Right. As long as we're in the comfort zone, everything goes smoothly.
yeah.
Nobody thinks of change.
Nobody, yeah.
But when something happens, that's when we think of change. Yeah, for me it was a little bit different because I was burnt out and I love natural products, and I wanted to do education and to try to prevent diseases. And I discovered functional medicine and I said, okay, this is the way I'll do this.
Yeah. Awesome.
So passionate about it. So fantastic. So what is your niche? Tell me a little bit about your niche in functional medicine.
My niche in functional medicine is to help women with hormonal problems to reset, rebalance, and restore their hormone health. And of course, I do this from childhood, like puberty stages, people with acne, period problems, PMS, and then of course pregnant women, and then postmenopausal and perimenopausal women as well. So by doing cutting edge scientific tests, we're able to come to the root causes of their problems. It's most times not just stemming from hormones, but it could be a whole lot of gut issues, stress-related issues. So this holistic approach to help and through supplementation and education often results in them optimizing their health, and they thrive, and they end up living a life full of energy, vitality, and longevity as well.
Yeah, it's like we're helping people. You're helping people practically design their health.
Yeah.
Not leave it up to chance, especially when you start with young children.
Yeah.
They know what to do forever, which is amazing. The best gift after life, right? That we can give them.
It's just it's priceless.
Yeah. And I bet parents are so grateful.
So grateful, because most times by the time people come to me, they've tried the traditional medicine route and they have failed, and they have not got answers, and they feel stuck, they feel lost. So by the time they come to me, we start to unpeel the layers and transform them. And by showing them what to do, by doing tests, they're able to revert and to go back to their normal lives. And it's always so shocking and so amazing to them that they've managed to reverse whatever the issue was.
Yes, absolutely. And it's a personalized approach.
Yeah.
It's not an approach to a disease. It's an approach to a person. I think so many people don't. So I think people appreciate this personalized approach so much. They're not treated as a disease. They're treated as a person because we're unique. And everybody deserves a precision medicine approach, right? So I think that's why it's so powerful. And people don't know what they don't know. Have you noticed that? They don't know, right? That some diseases, some diagnoses, they can be reversed. They think that they have to be on a medication for the rest of their lives, and there's nothing they can do about it. And when they find out about this approach, it's like a whole new world.
Magic, yeah? Miracle.
Miracle.
Miracle, yeah, is the word.
Yeah, absolutely. When you discovered functional medicine and you started implementing and training, did you have support? Did you encounter any resistance to this, or not really? From colleagues, from family?
Okay, sorry to interrupt. Yeah. So when I discovered functional medicine, I already had my own aesthetic practice, and I was working as a part-time general practitioner, mainly as a locum or bank staff. So I just went for it, and I was very clear-headed about it and very passionate about it, and nothing was going to stop me. And I was happy to take on any resistance, because for once, as a family physician or general practitioner, I basically got tired of seeing people coming every year us treating symptoms, not coming to the root cause of their problems. And then each year, they're not only fighting the disease getting worse, but they're also fighting the side effects of the medications. So it was quite frustrating. And now here's functional medicine that is actually offering a reversal or sending someone into remission. And there is just no comparison. And I still believe both can function together. There's room for traditional medicine, but there's also room for functional medicine. And I think really this is the future of medicine.
Absolutely agree. Absolutely. And people feel it. Don't you think that the attitude of patients that you see now in functional medicine is totally different from the attitude of patients that come to the traditional doctor?
Totally. Mm-hmm. So if I compare the two, if you have obesity and thyroid problems, they will come and see the traditional medicine doctor, who will check their symptoms and treat them based on their symptoms. They'll run tests, but ultimately the medications that will be prescribed will be for symptoms, and everybody will be given the same kind of medications. No explanation about lifestyle, no explanation about doing gut health tests or hormone tests. So each symptom is treated like it's a different part of your body. Whereas in functional medicine, it's a holistic approach. If one system in the body is going wrong, surely the other systems are compensating and also starting to go wrong. So if you can look for where the things are going wrong, you're more likely to come with a personalized approach. And what I find in functional medicine is that everybody's result is actually different. I'm yet to see anybody with the same result. When you do gut health, everybody's result is different. Hormone health, everybody's result. Urine, nutritional deficiencies, minerals and vitamin deficiencies, all different. So it's mind-blowing that when we are doing functional medicine, we are able to see all these things and correct them one by one. Whereas in traditional medicine, everyone is treated generally, and so nobody's getting better. And I also find you empower people in functional medicine through education, through lifestyle changes. They suddenly pick interest in their lives. And you find that it's these lifestyle habits that are actually causing these chronic diseases in the first place. So when they start reversing the lifestyle, like start moving more, doing exercise, start eating more carefully, cutting out refined sugars, avoiding processed foods, when they start sleeping better, when they start working on the stress levels, things start to change. And when they see results coming in, they're empowered. And these are long-lasting results as well. These are habits that if they carry on doing, will change their lives forever.
Absolutely. I mean, if we compare traditional medicine patients and functional medicine patients, the goals are different. In traditional medicine, you're trying to, we were taught to prevent complications, but keep people on the same medications and add more and more as more complications arise. While the purpose in functional medicine is not to see a patient forever, to get them well, to give them the wings to fly, basically. And, empower them to live a healthy life. So they're totally different pathways and different destinations.
Yeah. But at the same time, it's the system, it's the education system for traditional medicine. That's how we were taught in medical school. If we didn't tumble upon our own problems in life that led us to functional medicine, would be strong believers in traditional medicine because of the ignorance of not knowing, and also because of the stressful jobs that they have in traditional medicine, without realizing that stress in itself is a very big cause of disease.
Absolutely. And so many physicians have medical problems, and they definitely shove the stress under the rug, so to speak, because they say, well, this is expected, everybody's stressed. Well, well, yeah, everybody has stress, but if you take on stress and how you deal with stress, those are different things.
I agree, totally agree.
Yeah, so many physicians need functional medicine.
Yeah.
That's for sure. That's for sure. Knowing what you know now, would you have done anything differently like 20, 30 years ago?
If I had known about functional medicine 20, 30 years ago, I would have started practicing 20, 30 years ago.
Right?
I mean,
yes.
it's a no-brainer to me anyway, because you help more people, you help yourself, you help your families, and you make the world a better place.
Yeah, absolutely. And I think functional medicine is, so to speak, the best kept secret.
So true. So true.
And I wonder why so many physicians are so oblivious. And even when you talk to them about it, they're so defensive. They don't want to deal with it, to find out about it. And definitely a lot of physicians are resistant towards mindset change, personal development.
Yeah. Mm.
Why do you think that's happening?
Again, it's really the training and the busy jobs they have. They don't have time to think outside of what they've been trained to do, and they truly, totally believe in the system. And so it's very difficult to break that. So unless somebody has experienced something personal, a tragedy, and chronic illness, cancer, they don't stop to question things. The conventional medicine workload is so big that you literally go in, work the whole day, go back to eat and sleep, only to go back and do the same thing the next day. So there's no time to actually think outside the box.
Yeah, yeah. It didn't used to be like that.
I know.
But it's an unfortunate regression. It's not progression.
Yeah.
It's regression of the medical system. Yeah. So that's why I started this podcast, to try to hopefully have more eyes open and more people, joining, looking at functional medicine before something happens. Before something happens.
Thank you. Thank you for that. Because
Yeah.
as you said, there's a lot of education needed to raise awareness about functional medicine and how good it is and how life-changing it is.
Yeah, absolutely. Absolutely. And I think it follows, in my opinion, it follows the Hippocrates Oath the best, actually. But that's my opinion. So let me ask you this. Like, if you were writing a letter to yourself 10 years from now, what would you love to write in that letter? How would you describe your life? What would have to happen to be like a wonderful, wonderful life 10 years from now? What do you think?
Well, I'll start by saying, first of all, if I hadn't done functional medicine or changed my lifestyle, I probably wouldn't be here 10 years from now. Because the diabetes would have got the complications, stroke, heart attack, name it. So I'm grateful for that. That's the first thing. And then 10 years from now, I would have lived a life of fulfillment, helping so many people. Although my niche is women, I do help other areas of medicine as well. I help a lot of children with autism, ADHD. I help a lot of people with gut health issues, infertility issues. I help men as well with the prostate problems. So to be able to have the privilege and honor of helping these people 10 years down the line, and these are very grateful people. Once you show them what to do, once you discover what is the root cause of their problems, once you give them the personalized programs, they are able to maintain a healthy life full of energy and vitality. And for me, that is the biggest reward ever. But I'm also looking 10 years from now, I'd be happy to build a community of people to educate about functional medicine, educate about hormonal imbalances, educate about gut health and the importance of gut health, to educate just about lifestyle and the importance of changing lifestyle, and have a supportive community of people with similar minds, similar knowledge, who help each other. And I think I would be so grateful if I could achieve that 10 years from now.
That is a beautiful vision. Everything's possible.
True.
Everything's possible. And I think that, I mean, just listening to this, and I think everybody will agree with me, just listening to this letter, to this vision that you have, I can see that your heart is so giving and so big, and that impacting people's lives is really your goal, right? And you dream so much bigger than you would have if you were practicing just as a general practitioner, right? Because
so
probably
true.
wouldn't have even dreamt to begin with, right?
Yeah.
But this functional medicine opens the doors, and wow, everything is expansive. Nothing is constricting. Everything's expansive, and the energy is there, and people feel it, right?
Yeah, people feel it. And one more thing is, I feel like for instance, in the UK, the National Health Service is a free service. Imagine if we reach that level where we could get functional medicine tests being done at that level. We would all live much happier lives. They would save so much money because there will be fewer need for hospital beds, and everyone will be a lot healthier. It's just another dream that I have.
Absolutely. Absolutely. It's, we want to protect, and especially our children, because it seems like childhood disease and obesity, it's rampant. And I didn't know any sick children when I grew up. None of us were sick or in a hospital or anything chronic. And we were in big schools. It's not like we're talking about 10 people, right? We're talking about thousands of kids. And to see now that what 1 in 5 teenagers is obese, they have diabetes, they have chronic illnesses, so many children with autism, with ADHD, it's very sad. It's very sad, and it's not what we wished for the next generations and for our children to deal with. And if we can stop this, if we can put a halt to it and bring the health back to the norm, not the sickness to be normal, but the health to be normal and prevalent, we can definitely change the future of the next generations.
Yeah. And like here in the UK, about 40% of children are depressed. And I cannot even imagine anything worse than that. 40% of children who should be living happy, innocent lives are depressed. I mean, that's just not acceptable.
No. And the truth is that the lack of nutrition and the environment is definitely one of the biggest factors, the toxins and everything. And when we do the nutrigenetic testing and you see, that's why this child got this, because he doesn't have this enzyme in the liver to detoxify these products. So two siblings may react differently to exactly the same substance, and the parents don't see that, as they don't understand that. And it's so frustrating. It's we can start the work from inside, and then we can start trying to influence the decisions for the environment. But there are some big voices out there that are trying.
Yeah.
And hopefully when everybody gets together and they have a common goal, hopefully we will be listened to. But
so one day. For now, one person at a time. Every life is priceless. So we just help one life at a time, and starting with us, right? Because if we are healthy, then we can help so many others. Yeah.
This is amazing. Amazing. I want to thank you for being my guest today. And this was a fantastic discussion. And I want you to please tell everybody how they can get in touch with you, and we'll post all the links. But for somebody who's in US, could they reach out to you, or no, not really? Only if they're in UK? Or how does that work?
No, I work virtually. So we do Zoom consultations, and we order test kits all over the world, and we have supplement stores, like good quality supplement stores all over the world, in the US as well. And so I work with everybody all over the world. So if anyone wants to contact me, my website is www.drgracehulafunctionalmedicine.com. And our email is info@drgracehulafunctionalmedicine.com. And I'll be more than happy to help anyone who needs help.
Perfect. Wonderful. Thank you so much. Look forward to us connecting again and meeting in UK next year.
Yes, that would be amazing.
Awesome. That. Yes. Absolutely. It will happen. That's the vision.
Let's make it happen. Yes.
Absolutely. Everything is one decision away.
Yeah, true. So true.
Everything.
Thank you. Thank you so much for giving me this platform. I really do appreciate it.
My pleasure. Have a great evening.
Thank you. Bye-bye.